Bismillahirrahmanirrahim. Today we will discuss about hepatitis. And what is hepatitis? What are the types of hepatitis, causes, symptoms, and treatment of hepatitis? Hepatitis refers to an inflammatory state of liver, which causes inflammation in the liver. It is usually caused by viral contamination. There are other potential causes of hepatitis. Autoimmune hepatitis, hepatitis that follows as a secondary consequence of medication, drugs, toxins, and alcohol. Causes of hepatitis. Causes of hepatitis can be infectious and non-infectious. Infectious causes contain viral, bacterial, fungal, and parasitic, and non-infectious causes contain alcohol, drugs, autoimmune, metabolic diseases. Sources of hepatitis. Hepatitis is 60% caused by injection drug use. 10% causes of hepatitis are unknown. Other causes of hepatitis are 5%. Transfusion before screening is 10%. The percentage of hepatitis through sexual contact is 15%. World Hepatitis Day is celebrated on 28th July every year to create awareness among the peoples to know about what is hepatitis, what are causes of hepatitis, symptoms of hepatitis, and preventions of hepatitis. Subscribe to InfoHub so that you can get more informative and interesting videos. Types of hepatitis. There are 5 types of hepatitis: hepatitis A, B, C, D, and E. But most of the people are commonly affected by hepatitis A, B, and C in the world. Now we will briefly discuss types of hepatitis. Hepatitis A. Hepatitis A is triggered by an infection with the hepatitis A virus. In short, it is called HAV. Most of the time, HAV infections are mild. Sometimes these infections can be severe and life-threatening. Mode of transmission of hepatitis A virus is frequently transmitted through consumption of food or water contaminated by feces of individuals suffering from hepatitis A. Certain sex practices can also spread HAV. Symptoms of hepatitis A are reduced appetite, jaundice, fever, dark urine, nausea and vomiting, pain in the right side of the abdomen, digestive disorders or diarrhea, joint pain, and weakness. Causes of hepatitis A are sexual contact with a sick person, failure to comply with the rules of personal hygiene, consumption of contaminated food, use of non-sterilized syringes, use of contaminated water, household contact with the sick, general towels, dishes, and more. Swimming in the dirty water, staying in a large crowd of people. These are the causes of hepatitis A. Treatment of hepatitis A by using hepaprotectants, anti-inflammatory drugs, enzymes, copious drinking, meal 5 to 6 times a day, vitamin therapy, and diet. Hepatitis B. Hepatitis B can cause serious liver disease and liver cancer. Mode of transmission of hepatitis B is exposure to infected blood using contaminated injections, semen, and other bodily fluids. Infected mother to child during pregnancy. Hepatitis B also possesses threat to health workers for accidental needle stick injuries while caring infected hepatitis B virus patients. Chronic hepatitis B virus infection can lead to liver cancer, liver failure, and cirrhosis. Symptoms of hepatitis B contain jaundice, encephalopathy, ascites, pulmonary edema, violation of blood clotting, edema, bleeding from the esophagus and stomach, and itching of the skin. Causes of spread of hepatitis B are intrauterine through the placenta, during childbirth from an infected mother to a child, use of non-sterilized syringes through wounds, insect bites, and animals. When using a non-sterile instrument for dental procedures, tattoos, pedicure, and manicure, with blood transfusion and sexually. Treatment of hepatitis B contains hepaprotectants, antisorbents, enzymes, glucocorticosteroids, drink plenty of fluids, vitamin therapy, and diet. Hepatitis C. Hepatitis C HCV is a part of group of hepatitis viruses. Mode of transmission of hepatitis C is mainly transmitted through the exposure to infected blood products, contaminated injections, and injection drug use. In some cases, sexual transmission of virus is also possible, but it is less common. Symptoms of hepatitis C contain jaundice, ascites, nausea, vascular hysterics, intoxication, joint pain, asthenia, lack of appetite. Causes of spread of hepatitis C contains with donor blood transfusion in case of insufficient sterilization of instruments in tattoos, manicure, cosmetology and in dental clinics. Use of non-sterile needles for injection during sexual contact, during childbirth from mother to child. Complications of an infectious or bacterial disease during pregnancy from mother to fetus and during operations. Treatment of hepatitis C contains hepaprotectors, antiviral, anti-inflammatory drugs, enzymes, copious drinking, meal 5 to 6 times a day, vitamin therapy and diet. Hepatitis D. Hepatitis D is also identified as the hepatitis delta virus. It is an infection responsible for liver inflammation. Hepatitis D can cause swelling, which can damage liver function and cause lasting liver problems containing liver scarring and cancer. The symptoms of hepatitis B and hepatitis D are alike, so it can be tough to define which disease is triggering your symptoms. Hepatitis D virus infection occurs only in those who are infected with hepatitis B virus. It is usually spread parenterally. Symptoms of hepatitis D contains intoxication, increased bilirubin in the blood, jaundice, cirrhosis, simultaneous enlargement of the spleen and liver, physical weakness, violation of protein translation in the liver, and fever. Causes of hepatitis D are during operation. It is spread during childbirth from an infected mother to a child with blood transfusion, use of non-sterilized syringes through wounds, insect bites, and animals. When using a non-sterile instrument for dental procedure, pedicure, manicure, and tattoos. Contact household route of infection during sexual contact. Treatment of hepatitis D contains alpha interferon, hepaprotectors, intrasorbents, enzymes, drink plenty of fluids, diet, vitamin therapy, and antiviral drugs. Hepatitis E. Hepatitis E is a waterborne disease triggered by the hepatitis E virus, which is called HEV. HEV is mostly found in regions with a pitiable hygiene and usually results from ingesting a fecal substance that pollutes the water supply. Hepatitis E outbreak is more common in developing countries. It is mostly transmitted through consumption of contaminated water and food. There is high case of fatality rate up to 20% in pregnant females. Symptoms of hepatitis E contains yellowing of skin and eyes, nausea and vomiting, pain in the hypochondrium, reduced appetite, dark urine, bleed feces, raised body temperature to 38 degrees centigrade, severe weakness, malaise, intoxication. Causes of hepatitis E contains consumption of contaminated food when eating raw shellfish, sexual contact with a sick person, use of non-sterilized syringes, use of contaminated water, household contact with the sick, general towels, dishes, and more. Swimming in dirty water, staying in a large crowd of people. Treatment of hepatitis E contains protectors, anti-intoxication therapy, antispasmodics, antihistamine, glucocorticoids, drink plenty of fluids such as solution of glucose, sweet tea or mineral water, intrasorbents and diets. Overview about hepatitis disease, pathogen, symptoms, incubation period, method of transmission, and diagnostic tests done for the hepatitis A is caused by HAV. Symptoms of hepatitis A contain fever, headache, malaise, jaundice, and incubation period is 2 to 6 weeks, and method of transmission is ingestion, and diagnostic test done for IgM antibody. Hepatitis B is spread by pathogen hepatitis B virus. Symptom contains severe liver damage, chronic disease occurs. Incubation period contains 3 to 26 weeks. Method of transmission is parenteral or sexual contact, and diagnostic test done for hepatitis B is IgM antibodies. Hepatitis C is spread by pathogen hepatitis C virus. Symptoms of hepatitis C are same as hepatitis B and it is more chronic. Incubation period for hepatitis C is 2 to 33 weeks and method of transmission is parenteral. Diagnostic test is PCR of viral RNA. Hepatitis D is caused by pathogen HDV. Hepatitis D contains severe liver damage, high mortality rate. Incubation period is 6 to 26 weeks. Method of transmission is parenteral with co-infected with hepatitis B. Diagnostic test done is IgM antibodies. Hepatitis E virus is spread by pathogen hepatitis E virus. Pregnant women may be at high risk and show high mortality It is not a chronic disease. Incubation period is 2 to 6 weeks. Method of transmission is ingestion. And diagnostic test done for hepatitis E is IgM antibodies, PCR of viral RNA. Now, how we can protect ourselves from hepatitis? By hand washing, eating low fat and high carbs. Personal hygiene products should not be shared with anyone. Activity conversation, toxic substances should be avoided such as alcohol, etc. Individual bathroom should be used. Testing results, interferon and small but frequent meals. Subscribe to InfoHub for more interesting and informative videos. Thank you.